October 29th is the Stroke Awareness Day. We are recoining the name for the stroke as the brain attack. The reason is it also hits the blood supply of the brain, causing sudden catastrophic damage to the brain, resulting in paralysis of the body, either the hand or the leg, face, loss of speech, loss of balance and loss of memory. So, when it happens suddenly, the general trend is that let us settle down casually, let us go to the hospital, so and then take the treatment. So, the reason why we want to talk about as brain attack is that it should be taken as an emergency, and if we can reach the hospital, particularly the center for stroke, within 3 hours of the time, what we consider as the golden hour, we can reverse the problem damage that has happened to the brain. Essentially, brain attack is of 4 types. The first one is the blood vessel that supplies to a particular part of the brain is blocked by a clot. Now, when you come early, the clot is softer, and by giving a medicine, we can dissolve the clot. So, it is called ischemic brain attack, commonly known as the stroke or the paralysis. The second commonest is that a blood vessel that supplies to the brain can rupture at a particular point, causing bleeding inside the brain. It is called brain hemorrhage. This causes a paralysis suddenly along with severe headache. The third one is the subarachnoid hemorrhage, where an abnormality like a balloon on the blood vessels around the brain ruptures suddenly, producing sudden severe headache. It is called a bolt from the blue and a thunderbolt headache, very severe that one would not have experienced in the past, and associated with loss of consciousness and the neck pain, and is a very classical, and this is called subarachnoid hemorrhage. The last one is most commonly seen among the pregnant women or anyone who had got dehydration can develop a venous stroke, where the veins that drain the blood supply from the brain to the heart gets blocked. Because of the back pressure, there will be multiple small hemorrhages into the brain. Now, these 4 varieties have to be identified very quickly with a CT scan, so that the treatment modalities are totally different for each 4 of them, and if we can treat them in the first 3 hours, we can contain the damage, we can reverse the damage, protect the brain and promote the recovery quickly, so that the disability can be totally or significantly reduced.